Joining BYU Sports Nation now, medical correspondent and friend of the program, Dr. Matthew Poulsen. We're talking about Nick Emery, his early release from his mission to Germany due to something called Thoracic Outlet Syndrome, also known as TOS. Quite simply, doctor, what is Thoracic Outlet Syndrome in layman's terms?
Well, there's some nerves and blood vessels, important ones, that go from the shoulder area down into the arm, and they go into the thorax, and that's why they call it the Thoracic Outlet Syndrome. And you can pinch. There's a brachial plexus, which is like the major nerves going down to the arm, and it can be pinched, various causes, as it goes down into the thorax, or sometimes the blood vessel itself can kind of be constricted, and it can be caused by a variety of things, like the first rib, or even an extra rib that you're not supposed to have, like a cervical rib that comes off of one of the cervical vertebrae, or sometimes one of the neck muscles called the scalene muscle can get really enlarged and kind of compress on it. But that's what it is.
How does it affect a person?
It can be very problematic. I mean, it's typically with overhead type things, like, working on something overhead, or maybe you sleep and you notice that your arms are way above your head while you're sleeping, and you have all these numbness and shooting electric type pains in your arm. Or if it's constricting the blood vessel, then you can kind of lose your pulse, and you can fingers can turn white a little bit, or that kind of thing. But it can be minimal symptoms, or it can be very substantial and very problematic symptoms.
So certainly that can be problematic for a star basketball player such as Nick Emery, trying to deal with something like this if he wants to have a good career in the sport that he loves to play.
Absolutely.
Dr. Matthew Poulsen, orthopedic surgeon at Blue Rock Orthopedic Surgery and Sports Medicine on BYU Sports Nation, our medical correspondent. How do you treat something like thoracic outlet syndrome, doctor?
Well, you always want to start with non-surgery type stuff. I mean, sometimes surgery is required, but you always want to start with things like physical therapy, sometimes strengthening what's called the shoulder girdle, the bones and muscles around the shoulder. Shoulders are very complex, and sometimes some physical therapy to balance out the muscles, and that can really help lessen tension on it and really help. And icing, moist heat, anti-inflammatories, sometimes a brief course of oral, like prednisone, really strong anti-inflammatory, can help calm down inflammation and help things. And so that combination often will help improve symptoms. But if it's an anatomical thing that's impinging that structure of the nerve or blood vessel, then sometimes that does need surgery to either remove that structure or release it and make more room for it.
Is there an average timeline that it takes to get back to somewhat regular health with TOS?
I don't know that I know an average timeline. Some people it's maybe a few months, but some people struggle with this for a long time, years. Okay. But let's say that someone had a extra rib that they weren't supposed to have, but they were just born with it, and that's what the culprit is, and you have that removed for surgery, from surgery or whatever. That's a pretty high success rate, and so it can be a pretty rapid recovery, but this can be a complex diagnosis with a variety of causes, and so some of them are not as straightforward, and it can last a while.
Dr. Matthew Poulsen, orthopedic surgeon at Blue Rock Orthopedic Surgery and Sports Medicine, also a former BYU cross-country runner. Doctor, we appreciate the insight and the look at TOS.
Anytime. Thank you.